Alrighty. Well, hello everybody. We're live here at Sam's Fans, and today we have another music therapist as our guest. This time, Sarah Bentley from Nationwide Children's Hospital joins us today, and we're just gonna be talking about a bunch of things, music therapy related and Sam's Fans related. And you're all welcome to ask questions as we go along, as Sarah is an expert and she'll be able to answer all the questions real time. This is a unique opportunity. So thank you again if you tune in. You might see this right now, you might see it later, but either way, we're really happy that you can join us and that you can learn more about music therapy, which is pretty awesome.
Absolutely.
So first of all, let's talk a little bit about you, Sarah. Can you introduce yourself? Tell us what you do, and all that jazz.
Yeah. Hello, everybody. My name's Sarah. I actually grew up in near Athens, Ohio, which is near Ohio University. I have been musical pretty much my whole life. Was in voice lessons as a child. I actually got to discover the therapeutic power of music personally. I had a childhood cancer experience myself. So I found music to be, to impact my pain levels and really help me kind of deal with my illness and support myself emotionally. And so I found out that music therapy is a real profession and got connected to some folks at OU and knew that is exactly what I wanted to do. So I went to Ohio University for my bachelor's degree. And while I was in college, I saw the famous Brian Schreck video of the heartbeat recording. And that was kind of what first got me interested in doing my internship at Cincinnati Children's. And I'm very fortunate that I got to do my internship there. So I got to work with Brian, Catherine, Jen, Debbie, Beth, Caleb, and my co-intern Sydney, the wonderful team there. And that's when I first heard about Sam's Fans, was actually during my internship, and Brian had shared some stories. So from there, I began working at Nationwide Children's in the spring of 2016. And I went back to OU for my master's degree, and I'm currently working on my thesis for that. My thesis is going to be studying songwriting with long-term cancer patients. So I'm super excited about that. And so yeah, that's me.
Awesome. Yeah, we actually know some folks over at OU. We just recently started a music therapy scholarship over there with them. They all seem pretty great. Can you tell us a little bit more about their program and what you liked about it and all that stuff?
Sure. Yeah, I'm very proud to be a Bobcat. I'm very proud of my experience there under Dr. Geist and the faculty there. OU is a leading program in music therapy. It's actually, I believe, the only university in Ohio that offers a master's degree in music therapy. I believe Dayton may be also opening up a master's program. But yeah, OU is one of the first schools to offer music therapy. It was actually founded by one of the founding fathers of music therapy, E. Gaston, and so we're very proud of that heritage. So yeah, OU is special because it's a very student-centered and welcoming community. And yeah, you get to experience a lot of different practicum experiences. Students actually get out to different clinical sites starting your sophomore year, where some programs don't send students out into the field until their junior year. So we're very proud that students get exposed to real clients early on in their school program. So huge shout out to OU. I'm actually teaching there part-time as well. So I got to stick around, so yeah.
Awesome. Just real quick, Nikki says hi.
Hi, Nikki.
And she says that the thesis sounds awesome.
Thank you. I'm so excited to move forward.
Yeah. Great. So Let me hide this one. Going back to a little bit about you and what you do, can you also tell us about what you do at Nationwide Children's as far as music therapy, and what areas do you work?
Sure thing. So like I said, I started in the spring of 2016, so I've been there about 2.5 years. When I first started working, I was providing support to some surgical units and the GI unit, but since then I have focused on behavioral health and HEMOC BNT. So in behavioral health, I'm working with kids and teens who either have a psychiatric crisis or some kind of psychiatric diagnosis, such as depression, anxiety, suicidality, self-harm, autism spectrum, trauma, and PTSD, things like that. So at Children's, we currently have a crisis unit and an inpatient unit, and so I provide individual sessions and group sessions to both of those units. So a lot of what I'm doing in behavioral health is focused on either some kind of behavioral goal or some kind of emotional or just some stabilizing goals. So music therapy can help them learn to cope with their illness, so learning new skills like learning a new instrument or learning some regulation behavior management techniques. It's really fascinating how I can see a group of children who have hyperactivity or difficulty regulating their behaviors sit in a music therapy group, and they're following directions, they're playing instruments appropriately, they're being creative, and it's just really cool to see how music can transform those kinds of behaviors. I work a lot on emotional things as well, so a lot of these kids come from just really devastating situations, and music therapy can be the one thing in the hospital that brings up their mood, gives them some hope. It can help them express themselves, because who likes talking about their feelings, especially when you're a teenager or struggling with a really severe illness. And so music can be a really great way to express yourself, really kind of increase that sense of self-worth. There's like an Instagram quote, what I call, that goes around that says, "When words fail, music speaks." And that's kind of become an anthem for a lot of my kiddos on behavioral health. Music can really be that opportunity for them to just really explore themselves and express themselves and learn a lot about themselves too. And, being able to provide some kind of positive experience in the hospital setting can really improve treatment compliance. There's a lot of research backing that up as well. So yeah, a lot of the interventions I do on those units, actively making music. So that could be either through like a structured instrument play or through improvising. I do a lot of songwriting and lyric analysis, so really talking about songs that are important to kids and what they can learn from that, how that relates to their experiences, and also just talking about healthy ways that kids can use music at home. So yeah, that's what I do on behavioral health. And I also work in HEMOC, so I work with kids and teens who have either a blood disorder or some type of cancer. And so we provide both inpatient and outpatient treatment to this population. A lot of times kids are getting chemotherapy or a bone marrow transplant. And so I do mostly individual sessions on this unit. Typically, these kids have really chronic, frequent and lengthy hospital stays. And so I think really at the core of my job there is really just bringing a humanizing and normal experience into the hospital setting, and making that as joyful as possible in such a terrible time. So a lot of what I do is working on physical goals, so like helping helping with pain and symptom management, even providing music for physiological stability or for procedure support. So just the other day, I had a little baby who was getting an IV placed, or she was getting a blood draw, and because of the medicine she's on, her veins are really hard to find. She's a really hard poke, and so they had to call the special nurse from the access team to come in, draw her blood. And I got to provide music at bedside for her, and of course she was upset and she cried a little bit during her procedure, but afterwards she quickly calmed to the music and was easily redirected back to playing instruments. And it was almost like the procedure hadn't even happened. And the nurse talked to me later. She's like, "Oh, she cried a lot less hard when the music was there." And I was like, "Oh, that's really cool." So procedure support is something we can do in the hospital setting. Of course, I work on a lot of psychosocial goals as well. So promoting coping with hospitalization, improving mood, providing any insight or opportunities for psychological growth and learning about yourself. And of course, I do a lot of memory making on this unit too. So yeah, music therapy kind of looks different for each room. But, a lot of the times we're actively making music with patients, making legacy projects, music assisted relaxation. It just kind of depends on the day. So
right.
Yeah.
That's awesome.
Thanks.
Nikki commented again. She said, "I feel like music therapy must be so helpful in behavioral health. So thanks for sharing."
Absolutely. Yeah.
Yeah, definitely.
I do the best I can. Behavioral health is a growing population in our hospital, and it's often kind of overlooked a little bit, and so it's great to make an impact where I can. So we always need more music therapy for that population.
Right.
And actually, Nationwide Children's is in the process of building a new facility specifically for behavioral health. So I believe in 2020 that will be opening up, the new behavioral health pavilion. So we're hopeful that music therapy can be a part of that too.
That's awesome. Now that you're talking about music therapy at Nationwide, you've told us what you do, but can you tell us more about the whole music therapy team over at Nationwide and what populations you help?
Sure, I can say a little bit about that. So I believe music therapy has been at Nationwide since the mid 2000s. I'm not completely sure on that. But the program started with one music therapist in the whole hospital. And it has grown a little bit over the years. So we've slowly been expanding. And now we have actually the most music therapists of any children's hospital in the nation right now.
Oh, wow.
Yeah, it's a fun fact. Although about half of us are part-time, so whatever that to be in hours. But yeah, we have 5 music therapists actually dedicated to our NICU population, and that also includes some positions specific to research. So that's really cool that there's a lot of researching music therapists going on, research going on. We have one music therapist dedicated to hospice and palliative care, and I believe her position is supported by Sam's Fans.
That's great.
We have myself dedicated to HEMOC, and then there are 4 more of us, including myself, that serve the rest of the medical units in behavioral health in the hospital. So right now we have a tiny bit of outpatient presence, but it's something that we're always getting requests for more services for our outpatient areas of the hospital, but we primarily focus on the inpatient side for now. So, yeah, that's. Oh, and we also have an internship program at Nationwide. I believe we have had 8 or 9 interns in the past, and 3 of them actually now work at Children's as a music therapist. So that's really cool. So yeah, we're excited to have an internship program as well.
That's awesome. Yeah. Kaylee says hi, and you're awesome.
Hello. Kaylee is a former intern who is now a music therapist in our NICU, and she was actually a couple years ahead of me at OU. So Kaylee's.
Oh, okay. Yeah. Awesome. Hello, Kaylee. So that's great. Yeah, music therapy and nationwide sounds awesome, and that's why Sam's fans we love supporting, sending you instruments. As like you said, Jennifer, Jessica, who
Yeah.
works with palliative care and hospice, supported by Sam's fans. So
Yes,
that's pretty awesome.
forever grateful for your support. So
Definitely. Now, let's move a little bit to some stories. We would love to hear. I bet you have thousands, so we'll just hear a few.
sure. Oh, I love story time. Yeah, so working in a hospital setting, it really shows you kind of, I don't know, it's a really humbling experience because it allows you to really see some pretty devastating circumstances that children and families are faced with. But it's incredibly rewarding because it allows us to be a service that provides a glimmer of hope, a glimmer of something that's human and joyful during that situation. So, every patient interaction I've had has taught me something just about life and about myself and about music and about caring and helping. So, yeah, I could go on all day about that. But I have thought of a couple that I would like to share today. So the first story, and I'm not using real names, just to protect kids' privacy.
Definitely.
One really cool young man I got to work with in behavioral health actually last year. So for our inpatient psych units, most kids only stay for a few days or a couple of weeks. But this young man was with us for about 3 months. He was 16 years old and had attempted suicide. And he actually spent a while in the ICU for a lot of his physical injuries that he suffered. And then he was transferred to the psych unit where I met him. And I'll call him Jason for today. But he was incredibly creative and artistic and just really liked to express himself through music and through metaphor and through art. And he also battled pretty strong depression. And so each day that I met him, I kind of saw a different side of him. So he was kind of the beauty of music therapy is you can walk into a room and see work with the same person, but kind of see a different kid each day. And music therapy can meet that, meet their needs depending on the day. So initially, Jason and I worked on adapted guitar lessons. So he had played cello in the past, but he wanted to pick up guitar. So he made a list of songs that he found meaningful, songs that he felt represented kind of his mental health journey. And we worked on going through these songs and made like a folder, and he learned to play these songs on guitar. And he picked up really quickly, and it was just a really awesome experience to see him kind of feel a self-worth and positive self-esteem through learning this new skill while he was in the hospital. Some days he was just too depressed to even come out of his room or come out of his bed or to pick up the guitar. And so that was my job to kind of decide, okay, what are we going to work on today? So some days we just kind of met where he was at and did some improvising. Some days I kind of let him take the lead. Some days I kind of gave some more direction. But no matter what, music was always able to reach him where he was at and just kind of help him get grounded for the day. And his affect was always brightened by the end of each session. And as his hospital stay got longer, we started talking about how he can kind of take more ownership of the music and then kind of use that to process his mental health journey. So he began writing a song, and he didn't like to talk about things literally. He liked to talk about them in metaphors. So he talked about his experience of feeling like he was in a dark tunnel and kind of trapped and not really sure when he was going to get to the light at the end of the tunnel or the end of this journey. And so each week we kind of worked on building on this song. And I was intentionally not telling him things to say or things to write. I was just kind of prompting some questions that would get him thinking and adding his own lyrics. Sorry about that. I muted the beeping. But, and so, weeks went by and he was building on his song. He started talking in metaphors about things that represented hope to him. And one day was a really cool session in particular. He was talking about how a lot of staff and adults were kind of forcing him to be safe and to stay alive. And I asked him, well, what will help you kind of have this will for yourself kind of thing. And at the end of that session, he wrote a bridge to his song with the lyrics, "I will give my spirit drive." And so his whole bridge was just repeating that phrase over and over. I will give my spirit drive. I will give my spirit drive. And he wrote a chord progression for guitar that he felt really reflected the intensity of that lyric. And it turned out to be just a beautiful song. And I ended up recording his heartbeat, which a lot of people are familiar with that intervention from Brian's work for a lot of end-of-life situations, but I actually recorded his heartbeat as kind of a sound of life for him, as a sound, like a rhythm, literally sounding of his life. And so we recorded the song that he wrote to the beat of his own heart as kind of his will to live song. So that was a really, really fascinating cool process that I got to witness with him. Powerful experience in music therapy with him. So I like talking about that story.
Yeah, that's a great story. I really like that. That's awesome. Will you have one on the HEMOC side of your work?
Yeah, totally. So I've actually only been on HEMOC for 6 months now. And a lot of the kids that I've worked with, I'm still working with them. So I'm not really gonna give a lot of like names and personal details, but certainly my work on there, I like how music therapy restores the kid in each kid. A lot of patients on the HEMOC unit are, find themselves pretty sick and they don't feel like getting out of bed. They have a lot of pain and nausea and fatigue. And when I walk in the room with instruments, it's so cool to see how these kids light up. They sit up in bed, they'll start moving around and playing instruments and singing, and their faces will just glow when they're engaged in music. I have a 3-year-old who she loves music therapy, and she's kind of figured out my schedule. She's like, on Mondays I have music therapy. And the doctors were talking about discharging her a couple of weeks ago and trying to decide what day would be the best for her to go home. And she said, well, just don't discharge me on Monday because that's when I'm therapy.
That's awesome.
Yeah. But she's a very bright and sweet little girl. She likes to improvise and make up songs about animals during our sessions. So again, just to see the kid come out of her, the natural, normal child in her, we will go on and on about silly songs about animals and different things during her room. So she gets to be creative and use her imagination, things that she wouldn't naturally get the opportunity to do in the hospital. I have some kids who have a lot of anxiety around procedures. And so it's nice to know like what day they're coming into hospital, and I can be there when they're getting a port access or something and provide music for distraction or music assisted relaxation. I have a 12-year-old who every time I walk in the room, he asks for music relaxation, and he closes his eyes and engages in deep breathing, and he knows the drill, and that's kind of a sense of security for him. So And then in my teens, it's super rewarding to work with my teens on that unit and just kind of help them find a new normal, because such a hard age anyways, and then throwing cancer on top of that can make that just really difficult for teenagers. So some days I'm just talking about their favorite music that day with them and kind of drawing some meaning from that. I do a lot of songwriting and music videos with my teens, so they get to be part of the creative process, use technology, put some meaningful quotes and music together that they find that represents themselves and tells their story. So yeah, that's been a really cool experience, especially since I'm a cancer survivor and having a lot of memories of my own cancer experience and getting to kind of let that inform how I work with my teens. It's a really cool experience. So
that's awesome.
Yeah.
Going back to the first story, I don't think the comments are showing. Can you see
Yes.
a comment on the screen? Okay. For some reason I cannot, but anyways, if you can, that is good. It says, Patty, she's Nikki's mom. She says, that is a very amazing story. Hope he's okay. Definitely, we do.
Yes.
So we're kind of running out of time here, but we do want to have a little bit of time for Q&A. If anybody wants to ask a question, I do have one while people think about any questions they might have. So you said that when you were going through your process with cancer as a child, did you say you encountered music therapy?
I did not.
You did not? Okay.
I did not have a music therapist, but I listened to a lot of music recordings and I wrote my own songs. And that really helped, especially with listening to music. I had really bad insomnia. I couldn't sleep at night, or I had pain, and so the music kind of helped that to feel better. So yeah, I would have loved to have had a music therapist, but I did not have one. Well,
yeah. Right. So also going off of that, what do you think? Some people might think, well, if somebody's going through a serious illness, well, the top priority is the medicines, the doctors, get them physically right. So some might ask, well, music therapy is nice and it's really cool to have it, but is it really like a necessity? Should it be a priority? What would you say to something like that?
Well, I may be a little biased in my answer.
Right.
As a therapist, but oh geez. Well, certainly medical providers are concerned about saving the life of someone with a life-threatening illness or whatever medically is going on. I would argue that when anyone is suffering an illness, that treatment should be holistic and treat the whole person. So not just what's going on with their bodies, but what's going on with their friends and families, what's going on with their emotions and their coping and their development. So there's so much more to a person than a diagnosis or what they may be feeling in their bodies. And being in the hospital affects all areas of a person's life, and so we, as a treatment team, we should be concerned about every area of that. And the beauty of music therapy is there's a way that we can address all aspects of a person, whether it's physiological, cognitive, emotional, spiritual, social, you name it, there's a way that music therapy can have an impact. And so I think, yes, music therapy is very necessary.
Right. Yeah, definitely. I agree. Real quick, come on, guys, say hi.
The director of the music therapy program at OU. Hello. Nice to talk to you.
Awesome. Well, with that, we don't really have any more questions.
I'll throw in there just how much I use the instruments and materials from Sam's Fans. That's been super incredible and invaluable, especially now that I'm on HEMONT, because I am able to give some of these instruments away to patients who really respond well, especially the ukuleles. So yeah, sometimes kids really use playing the ukulele as a great distraction or as a coping skill or just a new skill in general. And so it's really cool to identify those patients that really benefit from having an instrument and may not have the means of getting an instrument. And so, but yeah, I'm running low, and I know Nikki was bringing some over. So
Yeah.
I definitely appreciate the support from SANS fans for that. I wouldn't. It's definitely easier to be a music therapist when you have the right tools. So
Right. Definitely. And if anybody's interested, now that she said that, we do have sort of a ukulele drive if you want to donate a ukulele so that the music therapists can do their job more effectively, because they can either way. But you can go to this site and maybe donate a ukulele. They're $25 because thanks to Guitar Center, they give us a deal. It's usually $40 for these ukulele, but we were able to buy it for 25.
That's awesome. I also use them a lot in my site groups. I usually have like 6 out at a time in my groups, so that's really cool too.
Definitely.
Yes, ukulele guy.
Awesome. And with that, I think we're about done here. Thank you, Sarah, for joining us today and for the great stories.
Thank you for hosting me. It's a huge honor.
Definitely. And for everybody that tuned in, we loved having you. And for everybody who's watching this a little bit later, also thanks for watching. Share it. Remember, every Wednesday at 3 p.m., we're doing this Facebook Live broadcast, so you can tune in and learn about music therapy. We're also having art therapists soon, so you can also learn about that.
Wonderful.
Awesome. And with that, say goodbye.
All right. Thank you. Goodbye.
Okay.